Hi, I'm Loretta Bush. I'm President and CEO for Authority Health. And today we're going to be talking about a very interesting topic, probably one that you don't think very much about, and that's humanitarian service. The World Humanitarian Day was established in 2003 to honor those who had been killed and otherwise put in harm's way for the humanitarian work and causes that they were involved in. The theme of this year's honor is It Takes a Village, and that really speaks to uniting partners to work collectively for the survival, well-being, and dignity of people across the world. Now, Dr. Albert Schweitzer, he was one of the first world humanitarians. And in his honor, there was a fellowship named after him, the Albert Schweitzer Fellowship. And that fellowship really aims to support, create, and ignite the humanitarians of the future. They offer 13 fellowships across the United States. And at Authority Health, we are very pleased that we sponsor the Detroit chapter. So today you're going to hear from two very special young women. They are two of the fellows in the Detroit branch of the Albert Schweitzer Fellowship. First off, I'll introduce to you Clair Hawthorne. She is a medical student from Michigan State University School of Osteopathic Medicine. Thank you for joining me, Clair.
Happy to be here.
All right. And then I have with me Asiimwe, and I'm going to let her pronounce her last name. Go right ahead.
Asiimwe Najjuma.
All right. Thank you for pronouncing that. And she is from Wayne State University Public Health Program. Welcome.
Thank you.
All right. So we're going to start right off by, I'm going to ask you both to explain how you became interested in humanitarian work and what made you choose the Albert Schweitzer Fellowship. Claire, I'll start with you.
Sure. Growing up, service was always a very large part of my family. I'd like to say my first volunteer experience was when I was 4 years old, because my parents, along with other community members, created this series of events for our neighborhood called the In the Park series. Okay. And that was such a vital part of my growing up, just seeing how it really doesn't take much to bring a community together. So that has always stayed with me, and with my interest in medicine, combining the two seemed to be a no-brainer to me.
That's amazing. And I love the fact when you say it really doesn't take much, because sometimes people think they have to leave the country and go on foreign land to participate in humanitarian services. But you and your family were able to do it right here. And it sounds like that ignited a spark in you.
Absolutely. And
fantastic,
yes.
Fantastic. Asiimwe, how about you?
Yeah, so my first big experience with humanitarian work was when I was a senior in high school. I went on a mission trip to Mexico City. And so for a week, we were completely unplugged. We were serving a population who lived in a garbage dump. And this population was completely disregarded by their nation's government in terms of their welfare. So we had the opportunity to just connect with them, build personal relationships with them, deliver items that they had communicated to us that they needed, like shoes and pants and things like that. Yeah. And so that week-long experience really opened my eyes to the value of not only service, but also the value of interpersonal connection within that service. And so coming back from that experience, when I studied public health in my undergraduate experience and now in my master's program, I realized that humanitarian work, you don't have to travel across national borders to be able to do that. And being able to study right here in Detroit and having the opportunity to have volunteered throughout my undergraduate time, I got to see that our very own city is in need. Cities all across the United States are. And so when I came across the Albert Schweitzer Fellowship and I saw that this is a fellowship that allows us to complete that humanitarian work right here for our brothers and sisters in our very backyards, I was really drawn to that opportunity to just be able to serve those who I might pass on my way to work or on my way to school.
Amazing. You know, and one of the things that you said, many of the things you said really struck me, but then when you said that it's also about connecting, that interpersonal connection, because sometimes, you know, we may donate something, but to be able to make that connection with the end person, the end user, the person who needs it to be in their space has to be amazing. Yeah. All right. So Claire, your project involves developing a health literacy program, and we're so glad that you chose the school, that Authority Health. We have our school-based clinic there. Talk to us about the importance of health literacy and the connection with schools.
Absolutely. Especially in our community, the African American community, our healthcare is often handed to us, and we're often not allowed to be the stewards of our own health because of a lack of knowledge. Literacy is a gateway to health literacy, but it's not implied.
That's right.
So there needs to be an extra push, I think, in our communities so that we can lead our own medical appointments. We can ask the questions that we really want to ask so we can be healthier as a people. Yeah. And I think we can start as young as possible. My program is with 6th and 7th graders, which I'm very excited about because people often underestimate how much children can grasp and hold on to and can teach to others. I know when I was little, I loved coming home from school and telling my parents everything that I learned that day. Yeah. And I know with something like this, maybe that could have the parents think more about their own health. So I see it while I'm working with the children, it can impact the whole family and even the wider community.
Absolutely. The children can actually lead in that regard when given the tools to do that.
Yes.
Very great. And then Asiimwe, your project focuses on nutrition.
Yes.
Very important, because we know that many of the chronic diseases that people face are actually can be food related and traced back to what we eat and drink. So tell us more about your program.
Yeah, so my program is a food delivery service for pregnant low-income women in Detroit. And so I'm partnered with Nurse Family Partnership. And the reason that I decided to focus my project on maternal health and nutrition is because when I first started studying public health in undergrad, one of the first major public health issues I learned about, specifically in the city of Detroit, is our maternal health crisis. The city of Detroit faces very, very poor maternal health outcomes across the nation, and the nation in general, when it comes to first world countries, the United States is doing very poorly when it comes to maternal health. And so the city of Detroit, our maternal mortality rate is 3 times that of the national average, and almost 50% of our households are facing food insecurity. Sure. So that means that we have a population of mothers who are vulnerable because of that, but also mothers who are facing food insecurity. Sure. And so this population is one that I wanted to focus on and make sure that these women who are facing this intersection of issues, that they know that they're supported and that they're protected. And so that's why I designed this food delivery service to be able to serve those mothers and to create those relationships with those mothers throughout the process.
Absolutely. And will it be food boxes, or what? How will it be delivered? What will be some of the items that will be in the box?
Yeah, so we'll be doing deliveries twice a month. I was able to partner with 2 different food banks that do 2 different monthly distributions. And so we're currently in the process of recruiting mothers. The goal is to get about a group of 15, and the goal is to deliver them food baskets twice a month that include recipes that incorporate the groceries that will be in the food baskets to also help further their own education when it comes to the importance of nutrition in the pregnancy process.
Wonderful. And both of your projects really speak to the importance of partnerships as well, because, you know, we can have great ideas, but we need partners, and we need connectivity to make them go. So let's talk again about the goal of the Albert Schweitzer program. Again, it's to find, to nourish, to encourage, to create humanitarians and people who really want to do humanitarian work throughout their careers. When you think about your own peers, Do you find very many who seem to be interested in this kind of work? If not, how do we ignite them? If you do, how do we continue to, support that, fan that flame, so to speak? Either one of you can start.
Yeah, well, among my cohort of my fellow peers who study public health, humanitarian work, I believe that a lot of us feel like it's a very essential part of the field of public health.
Mm-hmm.
And so I find that a lot of my classmates and I, we do tend to be drawn to service endeavors throughout the city and doing what we can in that scope. However, in the broader range, I do feel that our American culture, the way that we view humanitarian work, we often think that it requires a lot, whether it's that it requires a lot of resources on our part, a lot of money on our part, or a lot of time to be able to travel far and wide,
right.
When in reality, you really don't have to do much. And you don't have to go very far either.
Mm-hmm.
All you need to do is walk to your nearest church. You can find food banks, you can find Red Crosses, and these exist throughout all cities. And so I think one of the ways that we can help to encourage our culture towards humanitarian work is just reminding them that it requires very little. All it requires is a desire and a curiosity, and just following through with that, you'll be able to find plenty of opportunities.
Absolutely. Like you said, our brothers and sisters in need are right here, right around the corner. And there's churches, synagogues, mosques, everything around that can help to support. How about you?
Yes, and just to continue on that point, I also want to draw attention to there are already so many amazing organizations doing the work in the community. I also feel that, especially our generation, we feel like we have to create something new to be able to contribute and like put your mark on the community, but there's already such good work. Like I'm partnering with Hope Academy.
Yes.
The health center is already well established in the community, and they actually have a robust mental health program. So I think that finding where you can fit in and what you can do is something that I think would be a good reminder for our peers. I'm actually very heartened with my medical school peers. We have a lot of service organizations and students are really interested in that type of work. And I hope to see, I think that's something special about the osteopathic profession.
Yes.
That we view medicine holistically and truly do care about the entire person when making medical decisions. And I think that sort of philosophy lends itself very well to service work. So I'm very heartened by my peers' commitment at this time.
Absolutely. That sounds great. Well, I'm sure that makes our listeners feel more encouraged and more excited as well to know that there's others like yourself. So if you're just tuning in, I just want to share that today we are talking about humanitarian service, and I am here with both Clair and Asiimwe. They are both fellows at the Albert Schweitzer Fellowship, the Detroit branch, that's sponsored by our very own Authority Health. So if you are thinking about, well, how can I help? I'm excited about this. How can I help? You can go to www.authorityhealth and just push the donate button. And you will be able to support these fellows, but also future fellows as well. All right, so back to your projects. You're at the halfway point in your fellowship. Give us a sense of what you're learning and how it's impacting you as a person.
Sure. I'm still very much in the pre-work phase of my project because, working with students, I have to wait for the school year to start again.
Yes.
But even that sort of prep work has been really interesting in that I've had to really challenge myself to go back to that middle school time and adjust what I've learned at my academic level to make it palatable and exciting for the students. So that's been a really fun challenge, and I hope that they really connect with it.
I believe they will. How about you?
Yeah, so I'm at the point, as I stated earlier, where I'm in the process of recruiting mothers for my program. And so one thing that throughout the past few months of getting this project established, I've come to really appreciate the value of support. I feel very supported by folks at Nurse Family Partnership and also at this fellowship as well. Just being able to have them connect me with different members throughout the Detroit community. Those connections have helped me to find food banks in the first place. And so just going into all of the interactions that I'm having, knowing that this person, they have, they're established in their own field of expertise, and they
Sure.
have the potential to really help me throughout this project. So just being able to have that mindset of every interaction can help this project, which helps this population of women that I'm seeking to serve. So that's been something that I've really come to value.
For sure.
Yeah.
So now when you think beyond graduation and you think beyond the fellowship and you're now established in your career, how do you see yourself weaving your humanitarian service into the work that you will be doing post-graduation?
Yeah, so I would like to, after graduation, as I go into the workforce, I would like to work in community health, specifically in the maternal health sphere.
Okay.
And so I believe that this fellowship, I was really excited to have the opportunity to partake in it, because I think that it will be able to help me so much as I do advance into my career in public health. And I believe that just being able to take the lessons that I will be able to learn from my months of service for the pregnant women out in Detroit, being able to take that and bring those into the work that I'm able to do in the future, working in the city, is, I'm really looking forward to that.
That'll be phenomenal, because it sounds like you're really learning about connectivity and the importance of finding those partners out there, and you'll definitely need that as you advance through your public health career. How about you, Claire? When you're finished with medical school and residency and you're practicing family medicine, how do you foresee yourself weaving in humanitarian service?
Sure, and that's so vital to why I went into medicine in the first place. My family has had some rather unsavory medical experiences, and I think it's so important to be a representative of my community and help my community members with their health. So I very much believe in patient-forward care. No one knows your body better than you do, and no one knows your community better than you do. So I see my future role as a physician just as a steward, as a sounding board for my patients. So I plan on working in like the clinic atmosphere, in small clinics, keeping it very local in the community, and letting the patients tell me what they need. Because yes, I have this education and it's very valuable, but it's all about the patient at the end of the day, and it's all about the community at the end of the day. So I see my practice extending beyond the medical office, but going into the community and doing community health screenings, or just hosting different events, discussing nutrition, answering the community's questions, and just making myself as available as possible.
Fantastic. You make a very important point, because there are times when the teacher needs to become the learner.
Absolutely.
And the learner becomes the teacher. And that's very important when we're talking about impacting people's lives, their health and well-being. All right, well, I've asked you a lot of questions, but if I've missed anything, this is your opportunity now. If there's something that you would really like to say to the listeners now is your opportunity.
Sure.
We'll start.
Well, I'd like to thank you for listening to this interview. It's been a great privilege to be able to be a part of this fellowship.
Yes.
And if there's any message I'd like to send to the listeners, it would just be that it doesn't require much to be able to be a humanitarian in your community. Like I said, all it requires is that willingness and that curiosity. And as Claire said before, there are plenty of programs that are already established in our communities. And so just taking advantage of the organizations, the programs, and the resources that are already there, they're always looking for helping hands. So I would just encourage folks to have an open mind to that.
And jump into it. All right, Claire.
Well said. I would echo all of that and just add that this community is very important to me. I mean, being a daughter of Detroit, there's no other city like it. And I think having that pride in the city makes me want to see it grow, and we can do that with your support. So thank you very much for supporting us.
All right. Well, we at Authority Health, we value the contributions of humanitarians, not only here, but also abroad. And I really want to take this opportunity to thank both Claire and Asiimwe for taking time out of your lives, which is very busy while you're pursuing education and preparing for your further career, to really tap into your desire to be humanitarians. And so we know that you've already started on this journey, and that when you complete the fellowship and go off and are doing amazing things, that you'll also be humanitarians for life. So I want to thank you for listening, and as always, I say, knowledge is power, and we'll see you next time.